Hi, everybody. Thank you so much for joining us on Zoom today. I'm Dr. Aisling Whitaker, co-founder of Dental Hive, and I'm joined here with my team, and we're really excited to kick off our live coffee with us that we're going to have every 6 weeks. And I'll hop over to Felicia.
Hi guys, thanks so much for joining us. So my name is Felicia Sprague. I'm co-founder of Dental Hive and also regional manager. So I oversee two dental practices.
So, what are we talking about today, Val?
So today we're going to talk about how to plan a successful team training day, including team building and also some little tidbits about the value of dentistry.
Okay, cool. Yeah. So this is based on our full team training day that we did recently with our two clinics combined.
Mhm.
And we love team training. We love setting aside time for team training. We're pretty mindful to do that way ahead in the schedule so that we don't make excuses closer to the time, right? So we recommend that you think about a couple of either half days or full days for your calendar for the year, but have a plan for them. So we're hoping that this agenda that we're going to chat about today that we used can help you. And we're happy to share that we have the PDFs for the exact what we did blow by blow inside of the resources in Dental Hive.
Yeah, absolutely. I think that like team building and team training days really go hand in hand. Like having that dedicated day where the entire team just comes together to participate, collaborate, it's so crucial in making an office successful, in my opinion.
Mhm. We've done different types of team training days at different clinics that we've worked at over the years. I think together we've kind of come up with the types of things we think are worthwhile talking about at a team training day and the types of things that we don't. And some people might be a bit surprised by what we include and what we don't include. I think the biggest thing for you and I really is we see those days as an opportunity to get the team together and let the team gel and
Yeah,
let them
absolutely.
really start to kind of respect each other and understand each other, bring excitement back into the team and re-engage. And so for me personally, I really feel like there's not really a big role for financial discussion at
No.
these types of team trainings, right?
Yeah, I mean, you don't need to talk about production or hygiene retention. You don't need to talk about the statistics at these days. I think it's more about kind of encouraging a positive office culture, getting on the same page, standardizing your clinics, learning new things, or just like team building.
Yeah. Um, what are the different types of team training would you say for people to
Yeah,
know
I
about?
mean, I think you obviously have your standard like CPR days, or maybe, your hygiene team will do a course together
Yeah.
or something like that, right? But then there's also what I like to kind of call like information team training, where you're discussing clinic specific information. So maybe one day you're focusing on Invisalign and the flow of a case from like start to finish, who's responsible for what, verbiage. This type of team training, I think, gets everyone on the same page and standardizes information across the whole team, which I think is really important. You guys all should have a common goal, kind of know each other's roles in situations like that. So for me, like that's a really good kind of team training to have. I think you also have maybe like a core value or ethics team training. So this would be
Yeah.
discussing like the value of dentistry or enhancing the patient experience in your clinic, right?
Yeah, and communication too. Like I
Hmm.
think sometimes we focus our team training on clinical skills.
Yes,
And of course there's a role for the clinical skills training. But I think the biggest impact that we have seen on what happens next in our office is really training on the soft skills and talking
absolutely.
about communication with the patient, communication in
Yep.
the team, um, handoffs, like things that you take for granted, I think can kind of get lost, and you assume that people are doing the standard of communication that you want. Maybe that's not happening. So I think it's a great opportunity to really hone in on those things and talk about leadership and
Yeah,
well-being.
absolutely.
So many topics that that we like to cover throughout the year.
Yeah, absolutely. And I think it also kind of goes hand in hand with team building, which I think is my favorite type of team training day, honestly. You're really working on collaborative problem solving and personal reflecting, team and office reflection, and like colleague appreciation. It's such like a feel good, team training session. And it kind of really engages your team to the fullest. And I find it
Yeah.
really boosts team morale.
Yeah, absolutely. And I think, we made a uh, very strong decision that we were going to work hard on our team culture
Mhm.
and that we weren't just going to talk about it. We were going to actually implement these techniques with our team training days, but also with the surveys that you do and things like that to really um, improve our engagement of our team and their joy of dentistry, which is, such an important part of team retention.
Yeah, absolutely. And I think that that's what it is about team retention, right? When you have these team training days and they're dedicated days where, you're closing off the schedule, you're not seeing patients. I don't think sometimes the team realizes like how hard that is for the dentist. They're
Mm.
losing thousands and thousands of dollars to do
Yeah,
this, to like host a team training day and to really put like an emphasis on team building and
yeah,
team training. And I think it's just like it's so great. I think all
yeah.
offices should do that.
And I think the thing that the dentist should know is that what we've observed time and time again is that when we do it, our production increases. So yes, you lose
Absolutely.
a day or a half a day,
Mhm.
really honing in on what your core values are, what your goals are for the next few months, those types of things can really help. So we're going to talk about blow by blow what we did in our 1 day team training day that recently passed. We have put the agenda into Dental Hive, but we're going to talk about how it went and reflect on what we did. So, we decided to take a space outside of our clinic. We went to a local lab that has a team training room that's for free available for us. It has a whiteboard. We brought our markers. We had a presentation. And we decided that for this particular team training day, we were going to workshop it more than
Yep,
Felicia and I standing up there doing a presentation. We wanted our team taking part in this and that we would be really listening to our team and hearing what they had to say. And we had such a profound day, I would say.
absolutely.
People came back so energized, and it really helped us start off the year on a really great note.
It was so like interactive. And I think that some people are nervous about that, right? I mean, I think a lot of people on our team are introverts. They're not much for like, participation. But when you put your team into smaller groups and you get them to collaborate, we did some problem solving exercises.
Yeah.
We did some personal reflection, what's kind of working for our clinic, what's working for our team, maybe what are some challenges that we have, what's holding us back personally. When you kind of do some team building like that, it kind of gets everyone in this different mindset where it's like, oh, okay, I didn't know so and so, was having a hard time with that, or maybe it's like we can kind of troubleshoot this problem together that our whole
Yeah.
clinic is having. And it really gets everyone like on the same page and really motivated them, I find.
It was so motivating. So
Yeah.
we scheduled the day. We always like to provide a lot of snacks. That's a big thing. And actually that came up. Our staff want more snacks. So
More
very
snacks.
if you have any takeaway from today, it's provide a lot of snacks.
Yes.
Um, so we started off the day and Felicia led the morning workshop, and we're going to share that now in a sec. And it was really surrounding that team building. And I think starting the day, setting the tone with that, it it sets the tone for really who you are as a workplace. We're not starting the
Absolutely.
day with, here's our financial goals for the month, or this is how many new
Mhm.
patients we had. It was like, you are our team, we are invested in you, and like, let's really get together. And listen, we're not immune to the team turnover that happens, but I do find that we do have great loyalty amongst our team and overall good team retention. And I think things like this have really helped.
Yeah,
We
absolutely.
then we did invite a guest speaker in, so we invited
Mhm.
in one of our local specialists that we refer to this time for jaw pain, and we would do that on each team training day where we'll invite in someone we refer to or maybe a rep to discuss something. Broke up for lunch, and then after lunch, I went through some Invisalign workflow things, so very procedural. Some common questions that came up around that. And then our afternoon was spent talking about the value of dentistry. So I'm going to share our agenda from our team building morning that Felicia led. And this is available inside of Dental Hive. You can download it, and it will help you kind of curate that morning.
Yeah, so it was great. I mean, we started off with some collaborative problem solving. We kind of broke the group up into different teams, gave them each sort of like a problem. We discussed, well, they discussed first and then shared with the group, but like, how can we solve this problem? And then also, how can we prevent this from happening again? So one thing was like a miscommunication between team members leads to duplicate tasks. So, like, okay, so how can we solve this right now? Like, what do we need to do to fix whatever problem this is? And then what can we do moving forward so that, we're not miscommunicating, we're not like doing the same things over and over again. We don't have multiple hands in the jar kind of thing.
Yeah.
So I thought it was really good because each group had something different. And then afterwards, we all discussed it as like an entire team so we could have even more perspectives brought in afterwards.
Mhm. It was kind of cool because, Felicia and I are generally let's call us ourselves the end of the line problem solvers for the clinic, the more senior management. But there are so many problem solvers in our team. And one of the
Yeah.
initiatives that we kind of decided to bring in was we want people coming to us with a number of solutions for a problem that they see. And this was an opportunity to really hear different perspectives on some of the most common issues that come up. And some of them we wouldn't have thought of
Yeah,
ourselves.
absolutely.
So it was cool. It was like it encouraged even those quiet introverts to take part, because we
Mhm.
weren't just calling people out from the crowd. They were all in their mini groups. Um, but from that, we had a lot of action points for the clinic generally and updated some of our protocols afterwards.
Yeah, absolutely. And, our groups were really mixed. We had dentists, we had hygienists, assistants. So it wasn't just sort of like one team kind of focusing on the issues, like having kind of outside perspective on maybe a duty that would kind of fall more under like reception or something. And,
Yeah.
the assistants are chiming in, everyone was chiming in. So it was so great that everyone was so like active with it.
That's actually a really good point. I think it's important to do that because a lot of clinics can get divided up into, we don't love these terms, but like front of
Yeah.
house, back of house, or the assistant department and the hygiene department, because really we're all working towards the same common goal, right? And so we like to mix through our different teams so that people are interacting with each other. And I think it also gives a mutual respect, which is really important.
Yeah, absolutely.
I think one of the big, powerful moments that you had was the what's holding you back reflection. Do you want to chat a little bit about how did that go?
Yeah, absolutely. So this was kind of like an anonymous reflection, which I think really helped. People didn't want to talk about their problems like openly, but just really reflecting on something that was maybe like on their mind or something they're struggling with. We come to work and we have this expectation that, we have to be bubbly and we have to put our patients first, and we all do that so well. But sometimes we're coming in with a lot like inside of us, and it's really hard to kind of fake it sometimes. So just kind of giving everyone a chance to just sort of write down, something that was really holding them back, maybe personally or professionally. And then we collected all of them and read them all out without, saying who's each of them belong to. And that really helped kind of foster a lot of empathy among our team and just like a realization that like, oh my gosh, like, like all going through such heavy things and we're carrying it so well. And let's support each other, like let's help each other out. We don't know exactly who's going through what, but we know that we're going through a lot. So just having that empathy, I think, was really helpful.
It was pretty profound. Like I feel like everybody was crying. It wasn't the intention, right? But
Yeah,
everybody
exactly.
released. It felt like a group therapy and having them written on those anonymous post-its.
Yeah.
It was interesting seeing them because I feel like there was groupings of things. Like there was
Yeah.
a,
A lot of
su-
imposter syndrome.
a lot of imposter syndrome, um,
Yeah.
a lot of not feeling smart enough, a lot
Mhm.
of, you know, trouble in their personal lives and things like that. And it was really, there was so many similarities.
Yeah.
It was a bit of a wow moment for a lot of the team, I felt.
Yeah, I think so too. And I think that it was really good to sort of go from that, where we're talking about what's holding us back, into what we did next, which was our appreciation circle. And
Yeah.
I thought that was such an amazing moment. I think half our team were crying.
I know it was like it's supposed to be sad and then happy, but it just was sad and then
It
more
was just
tears.
sad and more sad. No, it was really nice because, you have all these feelings about yourself or what you're going through. And then to have someone else, I think we did, whoever was sitting to your left had to write something that they kind of
Yeah.
appreciate about you. And our team like took it like beyond, they were writing like amazing little love notes for each other. And, it was so nice to get to keep them afterwards and just kind of
Hmm.
reflect on, even when you're not feeling the best or when you're feeling that imposter syndrome, someone else is appreciating these little things about you and sees like what you're doing. And like that's so amazing, I think, for everyone to feel.
Yeah, there was definitely a lot of love in the room, and I
Mhm.
felt like it really did build a lot of connections between people. And yeah, like what a powerful morning it was. And I think we already do a lot. Felicia does a ton of check-ins with team
Mhm.
in person through surveys, shout outs, this type of thing. But doing it in person as a
Yeah.
group, you couldn't beat it. Like that was really powerful.
Yeah, absolutely. And like, sometimes the surveys are hard for people. It's hard to find time to fill them out. And, just having that moment where you had to sit there and really reflect on someone else and what you appreciate about them and their job and their duties. Like, I think that it was so important to sort of hear that too in person and not just through email.
Okay, so that was our morning, and it was beyond our expectations.
Absolutely.
Doing it as a workshop like that, rather than, us telling our team what we want from a team building perspective, was so profound. And I think if you only have an hour and a bit to do a team meeting like that, and then follow it with, maybe going somewhere doing an activity, I think that would be a really amazing half day.
Absolutely.
We did take the whole day though, so we did go on to having a specialist come in, chat to us a little bit, and then do a little bit of clinical skills, like I said, on our Invisalign workflow. And then we did our afternoon on the value of dentistry. So this is another team meeting agenda that we do have shared inside the resources of Dental Hive. So it's free. Actually, we have at least 10 or 12 team meeting agendas in there now. So if you're looking for ideas, it really does spell it all out for you, and you can take whatever bits from it that you find meaningful.
Yeah, grab different ones. Like you can use like a have like we did. We had a team building morning, and then we talked about the value of dentistry in the afternoon.
Yeah.
You if you plan a few a year, you can kind of divide them up how you see fit. But for us, I think the value of dentistry was so important for us to talk about, especially at the beginning of the year.
Yeah.
Just to kind of get everyone on the same page and
Yeah.
get our team really aligned for the
Yeah.
remainder of 2025.
And it was something that you and I had been finding maybe was starting to slip a little bit, even in our own mindsets. Like I think it's always going to be a tough one with dentistry. Dentistry is a high investment
Absolutely.
um, area of a patient's spending, and I think moving away from our own personal beliefs about money, which is very hard to do, and
Mhm.
really reminding ourselves about the high value of dentistry, both, from a biological value and a financial value. We know that the dentistry we do is very high standard, and
Mhm.
that there's a cost to that, the education of our doctors, the well-being of the patient, all of
Mhm.
those things. So, even as a dentist who helps teach this, and you and I both, we still have our own internal barriers to this, right? So I think it shouldn't go assumed that your team are on the same page as you or that you yourself don't need a refresh.
Yeah, absolutely. And I think that that's important is that like sometimes we do need to refresh ourselves, right? Like we dentistry goes up every year. You have to raise your prices on some sort of things. And then sometimes you'll have a patient be like, oh, well, I'm gonna go like to X, Y, and Z and see how much their Invisalign costs. Even though they've been a patient with yours forever, and you're like, you kind of start to doubt yourself, like, are my prices
Yeah,
too high? Like, but you're forgetting the value, like,
yeah,
and how like that is going to impact their confidence and their life and everything like that. And how
yeah,
hard we work in that procedure and all of our procedures,
yeah,
right? And it just comes to a point where you have to hold yourself to such a high standard and be like, no problem. Like, go get your
yeah,
second opinion, go somewhere else if
yeah,
you need to, and not kind of give into that thinking like, oh, I need to, reduce my costs or do something like that in
yeah.
order to keep my patients.
And I think the other side of it is too, like as the doctor, if you're the person going out and getting maybe more educated in a procedure, you're upskilling, um, do your team know? Do they
Hmm.
know where you position yourself amongst your peers, or your education level, or maybe the complexity of case types you can do. And so probably they don't know. And so allowing your team to be part of that, I think, is
Yeah,
very important.
for
So
sure.
the value of dentistry for me was a really important one because I do, I have imposter syndrome. I always have, I always will. And, at the on the same part, I put myself out there as a boss lady, but internally it's a little child who can't believe she grew up and she's a dentist. So I always have to recheck myself on this one. And I think this was a really great one to just regroup the team, and really feel really good about working in our clinic and the
Yeah,
quality of work that we're putting out there, and how we have a role in changing patients' lives. Like it was a really good one. It ended the afternoon on a really positive note. So this was our structure. We started off talking about asking our team to share words that they had about how valuable dentistry is, not financial, but the transformation that it provides to the patient or to them, or something that a patient has said or shared or their family member had shared. And we wrote these down on the whiteboard. And it was amazing.
yeah,
Like the team really believe in the transformation that good dentistry, having a healthy smile, having a bite that's not only comfortable but functional and has longevity. Like we as dental professionals, we really believe in that. And sometimes we have to be reminded on the day to day, but you could see that the team really believe.
believe in that too.
Yeah,
Absolutely. Yeah. Like they were all, they all had their input and you could see like as they're talking, they're coming up with more like ideas and more, words that they associate and everything like that. So
yeah.
it's really great to kind of see how like, involved and excited they were too, like about, dentistry and how proud they are of their work.
So proud.
Yeah.
Um, we jumped into mini groups and had a spokesperson for each group, so similar approach to earlier in the morning. And then they each had a topic. So the topics that we used were overall health, long-term finances, so like treating now versus the wait approach, how
Mhm.
that can impact, how that can impact confidence and emotional well-being. I think we added a few more too. We talked about kind of oral health decisions of one method over another in dentistry, and things like that because we had a large group.
Yeah.
Um, And it was cool. Like it was cool to see the team coming up with those, the verbiage, the speaking points to talk to a patient about these topics.
Yeah, exactly. And just like, again, you're aligning your team and getting everyone kind of like on the same page about how we're addressing, certain questions, certain concerns, which I think is really important as a clinic, the whole to be on the same page about those sort of things.
Yeah. One of the big things that you and I like to be ahead of whenever we're doing consultations with patients or financial presentations or treatment presentations is really being a step ahead of limiting beliefs. So by limiting beliefs, we mean, the cost, the dental anxiety, the patient kind of the asking the kind of ick question at the end. So in order to avoid most of those, we like to be presenting those same topics, but with a proactive, value-driven verbiage ahead of time. So we kind of did a section on creating value, so talking about that proactive verbiage first, and then
Mhm.
overcoming the limiting beliefs like dentistry is expensive. I think if you get to the those questions, often, if you're hearing those things often, those limiting beliefs, it means that you haven't created enough value up front. And I don't mean financial value. I mean the biological value, the transformation value.
Yep.
So we talked about a lot of solutions to those sort of negative sentences that can come along, so that we could, have really common verbiage amongst the team. And
Yep.
they helped us creating those.
And also like just having, like you said, positive verbiage. Like I think we got, why did my last dentist find these issues? And
Yeah,
it's like you're not placing blame on like your previous
of
dentist or
course.
anything like that. It gives you a chance to really kind of hype up your clinic now. But like, well, technology has changed so much. Like now we have iTero, now we have like, digital x-rays. Like you can really kind of show why like your clinic now is like, so worth all the money that
The
they're
investment.
spending, like the
Yeah.
investment, exactly. Like education, like dentists, you guys have a certain amount of CE per year that you have to do. So like that's okay to tell people. It's okay to tell like your team like what kind of, education you're doing. It's okay to tell your patients like that and to change your mind about things, right?
Yeah. And I think maybe we feel uncomfortable hyping ourselves up. And so you can do it in that subtle way, and your team can do it
Absolutely.
for you. Uh,
Yeah.
and the hype, the value driving can happen all the way along. So it can happen from, the moment they book in with you and what they see in the waiting room and the quality of the email communicate. Like that is all creating value all the way along. Not only the case presentation and being ahead of the limiting beliefs, but really thinking about all the different ways to create value for the whole patient journey.
Yeah, absolutely. And also like just making sure you're valuing like yourselves, right? And we've
Yeah.
talked about this multiple times where you see an emergency patient, maybe you're not charging the emergency code, right? Or we do so many scans per day. And just recently we started charging the scanning code because we're spending so much time going over, these digital scans with the patient and we're using it such like important diagnostic tool,
Yeah.
like it makes sense for us to have a value on that.
Yeah. Yeah. Absolutely. So that was our day, guys. And, we got a lot of feedback from our team that this was one of their favorite team training days that they have had. And we
Yeah,
kind of felt the same because, to be honest, Felicia and I didn't have to do a lot of talking, which we
which is
loved.
nice. We really love that. They make me so anxious, you just
Yeah.
have to plan a whole day and you're just kind of talking point after point, right? But when you break
Yeah.
it up into like fun little team building exercises and different topics like this, like it makes it so much more collaborative and interesting that the day just flew by.
And that was like a reason why we found it really important to create these team meeting
Yeah.
templates because, people are asking us all the time and we meet teams, we meet dentists, and they're asking us like, I don't even know what to talk about. So we really wanted to create those frameworks, those blueprints for people to follow. They can follow line by line or they can make it their own. But these kind of things are so important to do with your team, and they're not to be underestimated. I think the power of the amount of production you can see afterwards. So we have shared our team meeting templates for free inside of Dental Hive. Dental Hive is an app that Felicia and I co-founded. And it will be growing so much this year with more resources and updates and a lot of fun features too. So we would love for you to join us inside of Dental Hive. You can download it on either app store. And you will find the PDFs for these agendas in there. We do want to thank you for joining us today on your
Yeah,
break
thank
or your
you.
coffee time. And we do invite you to join us on Monday, the 28th of April at 12 noon again. Um, this time we're going to be talking about our quarterly management meeting. So once every quarter, our managers get together and we do a financial review of our clinics. So we're going to be going through blow by blow what we talk about. And Felicia's going to be reviewing all of the KPIs that she looks at and what we discuss as at a management level. And that's different from what we talk about with our teams. So it's really ideal for the office managers, for the dentist owners to join that meeting if you are not quite sure what you should be tracking at your clinic.
Yeah, I'm really excited about that one because I think it's really important for kind of all offices to know these benchmarks that are, that are important in dentistry and to know how to set goals and strive for the next one.
Yeah. Well, thank you so much,
Thank
everybody.
you, everyone.
And we will see you
Happy
in 6 weeks.
Monday.
Have a great week.
Bye.